You know, there's this really strange, almost terrifying paradox in medicine, where a successful cancer treatment can actually work a little too well. It's a condition called Tumor Lysis Syndrome, and it's where the very act of killing cancer cells can kick off a whole new life-threatening emergency. So how on earth is that possible? Let's dive in.
Okay, picture this. A patient with a really aggressive cancer gets a powerful new chemo, and the treatment is a huge success. I mean, it is just wiping out the cancer cells. But right in the middle of this victory, a hidden danger starts to emerge, and it's coming directly from the dying tumor itself. And this really brings us to a critical question that oncologists have to face every single day. What if killing the cancer is only the first battle?
Well, that new enemy is Tumor Lysis Syndrome, or TLS for short. Tumor lysis, it literally just means the bursting of tumor cells. And when they're all destroyed at once, they don't go quietly. No, they rupture and spill everything that was inside them, this toxic cocktail of electrolytes and waste products, right into the bloodstream. And that's what triggers this massive body-wide crisis.
So, how does a huge win suddenly turn into a potential disaster? Well, it's this rapid, four-step chain reaction that can spiral completely out of control in just a matter of hours. And it all kicks off the moment those cells explode.
Okay, so first, you have that massive release of all the cellular gunk. Second, this stuff just floods the bloodstream, completely overwhelming the body's main filtration system, the kidneys. Third, a couple of byproducts, uric acid and calcium phosphate, they start to form these solid crystals that literally clog up the kidney's delicate filtering tubes, causing them to shut down. And finally, with the kidneys offline, all these toxic electrolyte imbalances start to wreak havoc on the heart and the nervous system.
Let's get a little more specific and look at the actual culprits here. So when the cells burst, a flood of potassium, that's called hyperkalemia, can cause dangerous heart rhythms or even stop the heart completely. Then there's excess phosphate, which binds with calcium to form those kidney-clogging crystals we just talked about. The nucleic acids from the cancer cell's DNA, they get turned into uric acid, which also forms crystals. And because all that phosphate is using up the body's calcium, the calcium levels in the blood just plummet, which can lead to seizures and really severe muscle spasms.
Now, here's the thing. Not every cancer patient is at risk for this. So a huge part of the medical team's job is to figure out who's in the danger zone before a single drop of chemo is given. In this case, anticipation is everything.
So, what puts a patient at high risk? Well, really fast-growing cancers like Burkitt lymphoma or acute leukemias are right at the top of the list. The sheer size of the tumor, what doctors call a high tumor burden, that also matters a lot. If a patient is already dehydrated or has any kind of kidney issue, their risk just skyrockets. And, here's that paradox again. The danger is actually highest during the very first cycle of a really effective treatment, because that's when the most cancer cells are being destroyed all at once.
Medical teams make a really critical distinction here between two stages. So on one side, you've got laboratory TLS. Think of this as an early warning sign that only shows up on blood tests. The body is definitely stressed, but there aren't any outward symptoms just yet. But on the other side, you have clinical TLS, and this is the full-blown emergency. The patient is now actively experiencing life-threatening symptoms like kidney failure or seizures. This is when all the alarms go off.
So, what exactly are those alarm bells? What are the red flags that nurses and doctors are watching for with just incredible vigilance, especially in a patient they know is high risk?
The early signs can be pretty subtle. Things like nausea, muscle cramps, or maybe some confusion, but they can escalate really quickly to heart palpitations or even seizures. The most crucial sign, though, the one everyone is watching, is decreased urine output. If the kidneys aren't making enough urine, it's a crystal clear signal that they're getting overwhelmed and that the crisis is getting worse.
But here's the good news. Because TLS is a known enemy, medicine has developed this highly effective, really proactive battle plan. The entire goal is to stop the crisis before it can ever get started.
The playbook starts with aggressive IV hydration, often a full day before the chemo even begins, just to get the kidneys flushed out and ready. Next, medications are given to either prevent uric acid from forming in the first place or to break down any that's already there. Anything at all that could stress the kidneys, like common NSAID painkillers, is stopped immediately. And finally, high-risk patients get their blood tested every 6 hours to catch the absolute first sign of trouble.
And of all the things being monitored, this number is one of the most important, greater than 100 milliliters per hour.
That is the target urine output that nurses are constantly checking. It's such a simple, real-time indicator of whether the kidneys are keeping up with the toxic load. Just maintaining that flow is one of the biggest goals of prevention.
But what happens if prevention isn't enough and clinical TLS actually strikes? Well, the response is immediate, and it is intense. The patient is often moved straight to the ICU, they're put on a cardiac monitor, they're given drugs to correct all those dangerous electrolyte levels, and if their kidneys have failed, they'll be put on dialysis to basically do the kidney's job for them. It is a true all-hands-on-deck medical emergency.
Because the stakes are so incredibly high, there are several key pitfalls that medical teams train to avoid. For example, you don't give calcium to a patient just because their labs are low. That can actually make those kidney crystals worse. You never underhydrate. You have to learn to spot those really subtle EKG changes that signal heart trouble. And critically, you never ever delay action in a symptomatic patient just to wait for another lab result. You have to act first.
And really, this all comes down to the core philosophy of managing TLS, which I think this quote sums up perfectly. It's one of those conditions where being proactive, identifying the risk, hydrating early, monitoring constantly, is infinitely more powerful than trying to react to a crisis that's already spinning out of control.
And that leaves us with a final thought. Tumor Lysis Syndrome is a paradox that was born from our own success against cancer. So as our treatments get even better, even more powerful, what other unexpected challenges, what new paradoxes are we going to uncover? It's a question that really pushes medicine to constantly evolve, to always be anticipating the problems of tomorrow's cures.